Hello friends, in this video we are going to discuss about pituitary adenomas. So pituitary adenomas usually they arise from anterior pituitary. So they arise from anterior pituitary. They can be divided into microadenomas and macroadenomas. Micro or macroadenomas based on the size of the tumor. If it is less than 1 centimeter, that is microadenoma. If it is more than 1 centimeter, that is macroadenomas. Now, what are the clinical features that they can produce? Many of the cases are silent. Okay, so many of the cases are silent. That means they are non-hormone producing tumors. Okay, so they will not produce any hormones. Even though they cannot produce hormones, they can have some other features like they can produce mass effect because of their size. They can compress nearby structures and they can produce various manifestations. One of the important manifestations that we will discuss in the next slide, that is bitemporal hemianopia. It's a visual field defect. We'll discuss about that in the next slide. They can also cause hypopituitarism. Hypopituitarism. Now, how is this possible? Now, hypopituitarism is possible because of two mechanisms. It is possible because of two mechanisms. The first mechanism is because some portion of the tumor, some portion of the pituitary is growing, it will suppress the other hormone producing areas of the pituitary. Okay, so it will suppress the other hormone production. So so that is the first mechanism how it can cause hypopituitarism, and the second mechanism is there can be hemorrhage into the enlarged tumor. That there can be hemorrhage into the pituitary adenoma, and that is known as pituitary apoplexy. So these are the mechanisms by which they can cause hypopituitarism. Okay, so they can be silent, they can produce mass effect, they can cause hypopituitarism. Of course, they can produce hormone, and they can have features of hyperpituitarism. Among the hormone producing tumors, among the hormone producing adenomas, it is the prolactinoma that is most common. It is followed by growth hormone producing tumor, followed by other hormone producing tumors, for example, ACTH producing tumor or TSH producing tumor, or sometimes they can also produce gonadotropins like FSH and LH. Okay, so prolactinoma is the most common. What are the clinical features of hyperprolactinemia? They can cause galactorrhea due to effect on breast, and due to effect on ovary, that is anovulation, they can cause amenorrhea or oligomenorrhea. So classically, patients with prolactinoma, they present with galactorrhea, amenorrhea syndrome. Okay, now we see the concept of bitemporal hemianopia. So what do you understand by bitemporal hemianopia? So if you see here, so this is the visual pathway. You have to focus on the optic chiasm. So this is the optic chiasm, as you can understand. This area number 2, this area is affected in pituitary adenomas. So whenever there is a macroadenoma, it can pierce the diaphragm macula and it can come into the it can come near the optic chiasm and it can compress the optic chiasm from below. Now, whenever there is compression of optic chiasm, this kind of picture will be produced. That means the patient cannot see the temporal area. As you can see, as you can understand from this image, so this optic chiasm contain fibers from the nasal area. So it contains fibers from the nasal retina, and nasal retina is responsible for vision of temporal field. Okay, so for temporal field vision, nasal retina is responsible, and the fibers from the nasal retina will go through the optic chiasm. So whenever there is a lesion in optic chiasm, that will cause bitemporal hemianopia. That means the patient cannot see the temporal areas. Okay, so temporal field defects will be there. And one more finding, I forgot to tell that whenever there is pituitary macroadenoma, they can have this kind of feature. If it is going beyond the diaphragm cilia, they can produce snowman or figure of 8 appearance. Now we'll see the morphologic feature of pituitary adenomas. So in the histopathology, so you will find monomorphic cells. So you will find monomorphic, polygonal, tumor cells. So monomorphic means a single cell type will proliferate, as you can see in this image. Okay, so single cell type will proliferate. Along with that, you will not find the normal stroma that you find in a normal pituitary. So in normal pituitary, you will find excess of reticulin. But here in pituitary adenomas, the stromal reticulin will be less. The reticulin will be reduced. Okay. So monomorphic polygonal tumor cell growth along with reduced reticulin in the stroma is a feature of pituitary adenomas. Treatment for pituitary adenomas include transpyramidal surgery. And for prolactinoma, however, for prolactinoma, we use drugs like dopamine agonist that include bromocriptine and cabergoline. But for other pituitary adenomas, the first line of treatment is transpyramidal surgery. That's all about pituitary adenomas.